Hi, my name is Dr. E. I'm a hair transplant surgeon, and today we'll talk about most common causes of male and female hair pattern loss. We'll talk about the transplant procedure itself, and at the end of the video I will answer some questions that are most commonly requested, such as does it hurt, how long does the procedure take, what is the recovery, and of course how many units will I need to complete my procedure. Whenever the patient comes in, we do essentially what every doctor does. We take the brief medical history, and then we, in case we find something unusual, dwell a little bit more into it. The procedure does not involve only a physical examination, which includes for most common things that you would expect to have done in a doctor's office. We'll listen to the heart, listen to the lungs, talk about any allergies that you may have, and then talk about lifestyle habits. Most commonly, when somebody approaches us for hair loss treatment, we really have to understand in detail if the hair loss is due to most commonly offending factors. So let's talk about those. Most common offending factors when it comes to hair loss is stress, lack of sleep, improper nutrition, and age. So, as a part of the physical exam, we always want to be able to quantify how much does a person exhibit that hair loss. So in all medicine there are scales. When we want to take someone's blood pressure, we put a cuff around their hand and then we measure, and then we are received with some number. This number tells us whether the person has a high or low blood pressure. Another example, if we want to take someone's weight and we want to be able to essentially give him what's called BMI, or we want to be able to express a need for weight loss, then we use a simple scale, and then if the number is above the certain predicted range, we then recommend either weight loss or weight gain. Likewise, in a hair procedure treatments, we quantify the amount of hair loss based on density. And density refers to how many trees do we have in a forest. Do we see through these trees, or do we have a very thick and very bushy appearance of the forest? So here what you see is a group of images that we take from a patient. Initially, we take from all angles in order to quantify the amount of hair loss. And when these basic images are done, we actually do a proper hair analysis, right? We take a special camera and then we look for, at almost not a microscopic level but close to it, a amount of follicles that are located per square centimeter or a square inch. And as you can see over here, these numbers on the top tell us, based on the location of the head, whether it's on the mid portion of the head, in a center portion of the head, side and whatnot. And then this amazing program quantifies numbers for us. It tells us what is the ratio in between new hairs and old hairs, what is the ratio of number of units that are located per each hair follicle, and tells us about the actual hair width, and then what's referred to as the density of the hair that I just alluded to. So these numbers that I'll allude to in a little bit describe a need for a hair transplant. Okay? So let's take a look at a real-life example. This is that image of a hair that tells us in a visual way and also in a calculated way of, is there truly a need for a hair loss? I think one of the most prevailing questions is always what exactly is a hair transplant procedure and who needs it? Psychological well-being of a person depends upon, in a lot of instances, on the physical appearance. And in today's day and age, we're all subject to our own personal beliefs of what we should look like, and then the societal pressure. There is no right answer to this. When a person comes to us, the most important thing is to just take a side of compassion and then provide good physician care. That really is, in my opinion, the best description of who is a good candidate. The only person that is not a good candidate is somebody who's not medically healthy. And in that instance, that person actually does require some proper medical attention before any cosmetic procedures are provided or offered to them. Another thing that we're very often asked is, what is the difference between male and female hair loss, and do both sexes qualify for procedure? And the answer is yes. The difference between male and female pattern loss is in obvious description and image representation that each of the sexes have. Think about it. Have you ever seen a woman that has a male pattern hair loss? No. And that occurs because the word that is commonly associated with a female pattern loss, as well as male, is called androgenic alopecia. Not to overwhelm my listeners with big words, but an androgen is a sex hormone that guides a lot of our internal functions, including hair growth, skin health, and so forth. So in women, the most common way of exhibiting hair loss is by an appearance of a much thinner hair, and over a period of time, essentially loss of hair thickness throughout the entire scalp. As opposed to a man, the hair loss pattern begins in the front areas, and then in the areas above the sides, eventually kind of creating that M-shaped appearance on the top. So in order to truly understand that, this is where actually being a physician and doing this in a medical setting is very helpful. There are certain medical conditions that are known to cause androgenic alopecia. In females, it is, for example, a polycystic ovarian syndrome, and in males, things such as prostate cancer. And there have been instances where we would actually catch patients by doing exactly what we discussed, a proper physical exam, and then actually finding something that is a little bit more serious, in which case we send them to appropriate physicians for further care. What are the areas of the body that are most commonly requested for hair transplant? Let me just digress for 1 second. In previous segment, I talked about male and female hair loss pattern. Well, in today's day and age, as we're learning more about other people's preferences and choices of classifying themselves or talking about themselves, thinking about themselves, believing in themselves to be in a neutral role or in a transgender role, we actually wanted to bring that up as one of the important aspects of understanding the male and female anatomy and understanding a need of a person who is going through a transition process to be able to provide an adequate aesthetic appearance and also an adequate advice on where to place body hair transplant, for example. So let's discuss specifically about what are the areas that are commonly asked for hair transplant. Well, most obvious one, as you can tell, is the hair, right? The hair on the scalp. The other most requested area are eyebrows. The third most requested area is the beard, mustache, and then the fourth, as I alluded earlier, is the body hair transplant, which can occur anywhere in the body. So what is a follicular unit, right? So I want you to think about a hair follicle as a tree. Imagine the biggest, most beautiful tree that you've ever seen. And most often these trees are not singular. They don't have just one branch. These trees have usually 2 to 3 trunks, and that's essentially how you want to think in terms of a hair follicle, right? A follicular unit refers to a big mature tree that has a root, and us physicians taking that entire root alongside with a tree and then planting it somewhere else. In the case of a root of a tree that only has one trunk, that is referred to as a single follicular unit. If it has 2, it's called obviously dual, and then triple and so forth. Most commonly, there are follicular unit consists of 2 to 3 branches from one root. Next obvious question that most people have is that, so how many follicular units will I need? All right? So let's talk about that weight scale. Let's talk about that blood pressure analogy that I used earlier. When we want to measure someone's blood pressure and we want to find out if they have a high blood pressure or not, there's a number that comes up. And this is obviously referred to as a hypertension scale. We want to talk about someone's weight, we use a scale, and then we look for the weight scale, right? In the world of hair transplant, we use a scale called Norwood scale. So let me take you real quick through some of the things that I already described. So in here, on these images, you see a typical pattern of male hair pattern baldness, and it shows us exactly by the representation of these dots, where does the density of the hair occur and where is it located the most. The density of the hair occurs most often in this area, and this is what is commonly referred to as a donor site in both male and female. An appearance of a baldness, if you look at my hair, for example, there's a little bit of thinning that is happening over here. And because of the hair length and because of my own hairline, as it's represented approximately in this area over here, it appears as if I have a full set of hair. And believe it or not, actually I'm a hair transplant candidate, and I fully intend to perform this procedure, or get the procedure performed on myself by one of my colleagues. But the most important thing that when we look at somebody is we try to understand visually and then process it in our minds about an appearance of the person's physiognomy based on that frontline hairline. So if that hairline has a full thickness hair, it is most likely measured to have anywhere between 80 and 100 follicular units per square centimeter. So per very small area, imagine a person with a really thick hair that you have ever seen in your life. That person most likely has a density that is in that pattern. When you look at someone like me, who has thinning hair, my density, even though it doesn't appear as if I'm balding necessarily, is closer to this number right here. And then in a person who actually visually has a pattern loss, that number obviously decreases in a descending fashion. And for our benefit, we actually have this wonderful machine called the Hair Metrics imaging method through use of an artificial intelligence of how do we measure this particular density. So this tool is an invaluable tool. It is a device that we essentially use to scan the person's head, and the images that I've shown you before were taken with this device, and then it basically gives us a reading, much like a blood pressure scale or a weight scale or any other scale that is commonly used in medicine. When we try to determine the harvesting area, now that we understood what a person's male pattern baldness or female pattern baldness looks like, we actually always go back towards the area that most often, and well, not often, but always has the higher number of hairs, and that is located in the back of the head. This area describes a typical pattern in which we actually transplant per each individual session. And this is probably a very good time to discuss. When we try to recreate the appearance of a fuller set of hairs, we always begin by recreating the front part, the front line, because as I alluded in previous discussion, that front hairline demonstrates an appearance of a person having a normal physiognomic features. So in this area over here, we talk about creation of the beautiful hairline zone. And this is essentially one of the most satisfying portions of the procedure, where you can actually give somebody an appearance of the face in the way that they see themselves. Now, let's talk about this particular scale, right? So the scale that is used in understanding how many units to transplant is referred to as a Norwood scale in men, and there are other similar scales that exist in women. For the purposes of brevity of this conversation, we're going to just address this particular scale. As you can see, this scale, which is visually represented, is demonstrating a scale that goes between 1 and 7. And then there are some numbers that go in between, so we assign in between numbers of 2A 4A, 3A, and 5A, and then essentially looking at a person. So let's look at me for an example. If you look at me, I clearly don't have a full set of hair. I'm not in a stage number 1, and I am definitely not in a stage number 2. If you look at stage number 3, I probably fit more by my own male pattern baldness at my age in this particular scale. So I would probably vacillate as somebody who has a receding hairline in this area and somebody who has a little bit of hair loss in the crown of my head. So I will be probably classified as most likely 3A. So 3A to 3 vertex. So now that I know my own classification, we're going to go to a predicted table, and these numbers are approximately average. And in this table, we can talk about how many grafts would I need to recreate my front hairline and then to essentially to recreate a full set of hair. So if I'm in a 3 vertex category, I would most likely need anywhere between 1600 to 2200 hairs. And the two numbers in 2 columns that are located over here gives you the high-end range and a low-end range. The 3 vertex gives us a high-end range of most likely a follicular units needed for someone like me. And in a high-end range, if I wanted to fulfill the actual vertex of my hair, I would probably need anywhere between 1600 and 2200 units. For this number of units, this is a procedure that lasts for 1 day. An important thing to discuss going forward is that, see how there is a yellow highlighted statement that talks about grafts in a first hair transplant session. Well, an importance of actually explaining this at the inception of this transplant procedure path is that on the very first time when somebody has a virgin scalp with a blood supply that is abundant and there are no scarring on the head, that is the most important time to transplant as many hairs as possible. If a person is in higher number of this classification, this person may require a subsequent hair transplant, most likely a year to year and a half after the initial hair transplant. Whenever we discuss hair transplant procedure, the most important part is to be honest and to explain to the person that their desired appearance will depend upon the success of the first hair graft and their own perception of what they should look like. So if we go down this path, there is obviously an explanation that we tell to all the customers, is that it generally takes about 10 to 12 months to see the results of a follicular unit procedure. At that point, the hair is essentially thickened, it was transplanted into an appropriate place, and person for the most part can either finish their entire transplant journey or now come back to our office to talk about a need or a desire for a second hair transplant. So we never book 2 in advance. We basically let the person decide if they're ready. Unless, in some instances, when patients said, "Doctor, do this for us," you know, and there are people like that who essentially expect us to provide them our expertise, and when that occurs, we certainly can do that. So, if a subsequent hair transplant is needed, then we look at the first graft, and if you looked at for example, my numbers for the first graft between 1200 to 1600, if a second graft is needed, these numbers are a combination of the very first and a second transplant. So at maximum, for somebody like me, if I was to do 2 procedures spread a year apart, I would need anywhere between 1800 to 3200 units. So not a large number of difference, but there is probably about another 30 to 40% of a needed extra harvesting to place it in. In summary, when we talk about a follicular unit, it is also very, very important to talk about something that we discussed. So think about a graft size as a tree with 1 trunk or 2 trunks. We want when we transplant, all these follicular units to be transplanted and engrossed in whole. So we want one root with as many tree trunks as it possibly can. We never, or almost never, want to be able to split these into multiple grafts when we're implanting on the scalp. We do want to do that if we're implanting them on the eyebrows or on beard or in specific areas. So most often, if we have a 2-hair graft, we will get 1,000 grafts. If we have a 2-hair, meaning a tree trunk with one root, and if we wanted to split it, we could split it into 1,200 grafts. When we do this on a scalp, we never want to split these grafts. We want to have an appearance of a denser full hair so that we can provide the most optimal outcome. Another thing that we have been discussing is a procedure called FUE, or follicular unit extractions and then reimplantation. In some instances, when we want to take a larger number of units in once, meaning think about Super Bowl, right? And we bring the sod to a brand new field and then we take that sod away. Or think about a basketball arena that is one day basketball arena and the next day an ice rink. Well, in that similar fashion, we can take a small strip of scalp hair and then reimplant it into a specific area. That is actually most commonly asked procedure in people who just have a specific small amount of hair pattern baldness, or in people who do not want to shave their head, that are just interested in essentially having a portion of their hair only reestablished. The patient, when they come after a hair transplant consult, can expect truth, honesty, and hopefully a good laugh. We have a very ample and very agile medical staff that helps us evaluate patients not only by physical appearance, not only by talking, but also to analyze all the possible causes for hair loss. So our consultation involves drawing blood and understanding if there are any hormonal dysregulations. It also looks for some of the other indices in the blood that are deficient in some individuals who have a hair loss pattern, or rather who have hair loss, specifically vitamins like biotin, niacin, folate, and so forth. Recovery is kind of chunked in different stages. First of all, the procedure is, for the most commonly way described, a painless procedure. And the reason it's painless procedure is that because we have in our clinic multiple ways of how we can provide anesthesia. So let's talk about that. A procedure can have anesthesia by giving us a pill to the patient. We're just going to make him relax. We can provide what's called a topical anesthesia, meaning we can numb the area with the skin of the skin, and we can also provide what's called a tumescent anesthesia, which means that we can infiltrate local anesthetic in all areas that need to be done. We can provide spot anesthesia. We can also provide anesthesia through an IV by essentially putting a small cannula in a person's forearm or a person's elbow, and then giving the medication that way. And of course, the penultimate way is to give somebody an inhalation anesthesia. So an inhalation anesthesia can be done through a delivery of a small amount of nitrous oxide, which is an anesthetic gas, sometimes called a laughing gas, that just blunts the response of for example, a pinprick. But in all essence, if you give us your trust, what we often advocate is a combination of a small amount of inhalation anesthesia, where somebody just breathes a little bit of a laughing gas, during which time we would apply topical anesthesia, and that usually is all that is needed. So the procedure, during the procedure time, does not hurt at all. Post-procedure, obviously, there may be a little bit of discomfort, but most people tolerate this quite well with over-the-counter medications such as Tylenol, ibuprofen, and it usually kind of subsides within a day or two. The post-operative course is very simple. After about a week, most of the scarring is now in place, and then the procedure essentially is in a monitoring stage. We ask the patient to start essentially rinsing their hair with cold water. At about a 2 to 3 week mark, there is this process called shedding, where the transplanted hairs are kind of getting thinner, and after that initial stage, at about a 2 to 3 month mark, the new hair, as it starts to regrow, gives an appearance of ultimately where the person should be. So if you have a procedure on October 1st, you should by the New Year's, January 1st, have pretty good appearance of what the transplant has done for you. So in a short 3 months, you will see an immediate rewards of the procedure that was done just prior to that. And then about 6 month mark, you should resume your normal daily activities, anything that you would envision having done before hair transplant, including hair trimming and so forth. And about 12 month mark, you should have almost a complete brand new hairline that is your own hair, just in different part of the scalp, if you will, or eyebrows and so forth. Similarly, all the other areas, eyebrows, beard, follow the same pattern of healing. Thank you for staying throughout the explanation of the consultation at the One Spa Chicago. As always, there's always a number of questions that can arise from any discussion. We would encourage you to leave us comments in the section below. And of course, please continue following our Instagram posts, where we'll discuss in subsequent days more and more topics as they arise from our social media.